Another phrase you may hear while you're a parent in the NICU is something called family-centered care. And that seems sort of odd because of course it's family-centered. A baby, a mother, a father, all those are part of what defines family. It can be much more inclusive, maybe grandparents, families, friends. The whole concept of family is really individually defined by a person. We've moved in the NICU to what we call family-centered care, which means we believe and we act like it's very, very important that you be there. We want you there. We want you talking to us, asking your questions. We actually ask you to help us find ways to meet the goals that we have for your baby's care. We want you to be available to talk to the physicians. Sometimes that's done on rounds where you sit at the bedside while the team is there rounding and you can interact. Some units set it up where they set aside time for you every day or every week to have a more extended conference where you can be aware of what's happening with your baby, what are the current test results, what's our plan for the coming days. Family-centered care means that what you think is as important as what we think. And sometimes what you do is as important as what we do. And what we want to do is try and find ways to communicate that strategy back and forth. Family-centered care means you know a lot about your baby. You knew your baby long before we did. And what we know about pregnant families is that a whole lot of what you think about your baby is long before they're born. So we ask you, please share with us. Feel free to challenge us sometimes if you feel we're not being attentive to a concern that you have or a question that you need answered. And then to co-function with us in getting the best possible care and outcome for your baby while they're in the NICU.